Welcome to the Healthful Woman Podcast, the fastest growing podcast in women's health. Today's Monday, April 11th, 2022. In honor of our 2-year anniversary, we decided to drop back-to-back COVID podcasts, both with Emily Oster. Last week, we redropped our very first podcast from April 2020. Emily was our first guest, and we talked about pregnancy in the land of Corona. For those of you who joined us after the first podcast, I hope you got a chance to listen to it last week. It was really interesting to hear our conversation about COVID 2 years ago, right when COVID started. For today's podcast, Emily agreed to come back and to talk about COVID in 2022, looking back and looking forward. We go into a lot of questions and topics that everyone seems to be talking about. Where do we get it right? Where do we go wrong? And most importantly, when can I finally take my mask off on an airplane? Lots of good stuff. And as all of you know, Emily is awesome. So I'm sure you're going to enjoy hearing her take on all of this. As a reminder to all of you, we have a second podcast that drops every Thursday, and it's called High Risk Birth Stories. Look for it. We started it a year ago, and it's also gaining a lot of traction in the podcast space. If you enjoy this podcast, you will probably enjoy High Risk Birth Stories as well. Feel free to check out any of the birth stories told over the past year and follow us for the new ones. All right. Thanks again for listening. Have a great day. Welcome to today's episode of Healthful Woman, a podcast designed to explore topics in women's health at all stages of life. I'm your host, Dr. Nathan Fox, an OBGYN and maternal fetal medicine specialist practicing in New York City. At Healthful Woman, I speak with leaders in the field to help you learn more about women's health, pregnancy, and wellness. All right, Emily, welcome back to the podcast. Our favorite guest. How you doing?
I am good. I love to be here.
You were the first guest on the podcast, the maiden voyage, the very first guest 2 years ago last week. As I told you offline, we did redrop our first podcast so people can hear our predictions about COVID. Now, people don't do that like sportscasters. They don't go back and, say, oh, this is what I predicted for the NFL season because they're always wrong. But we were right. We nailed it. Good work.
And that's why we're releasing it.
Yeah. Yeah. And we said, no, this COVID will be gone in 2 weeks. We would never redrop that. So it's interesting. I mean, the things, when we were speaking about it, I know that you have had a lot of conversations in your life about COVID in the past 2 years. So you may not remember this one in particular, but clearly there's some things that are very different now compared to then. I would say most notably the vaccines, which is a game changer, obviously. But the interesting thing is, I was listening to it. There was arguments, about masking, about lockdowns and restrictions, about, data surrounding who gets it and who doesn't. And this was like 2 weeks into it. And now we're 2 years into it and we're arguing about the same things.
It's true. Although I was reflecting on sort of how the spring of 2020 felt relative to now. And on the one hand, I'm constantly thinking, I wish we knew more now. Like we could have better data. There's information that we're missing. But that reflection also reveals there's a lot that we know now that we didn't know then. So we did the same hike that we had done sort of in kind of March of 2020 last weekend. And my husband was reminding me that when we did that hike in March of 2020, like everyone was wearing a mask outside on the hike. And like at some point we encountered some other, small child, and my then 4-year-old yelled social distancing when the kid got too close. And so I feel like, okay, we have sort of evolved some of our understanding since then about things like outdoor transmission, but there's a lot we don't understand. And as you say, a lot of these debates feel like the same debate that we were having 2 years ago.
Yes, I'm curious, how do you feel about COVID now compared to, let's say, a year ago when the vaccines were first coming out and 2 years ago when it was just starting? Like, what are the major things that you think are, different in how you think about it?
I think the kind of uncertainty, the enormous uncertainty that inhabited basically every moment of the sort of March of 2020 seems dialed down. Mm-hmm. I will say relative to March of last year, some ways more existential angst or worry about the long-term effects of the pandemic. I was looking at my vaccine card for something. I got my first dose of the vaccine on March 11th and my second on April 1st of 2021. And I sort of remember that moment as feeling like, okay, like we're going to move to the next phase. parts of that feel true now. I mean, I think even more true because vaccines are better and because more people have natural immunity and all kinds of other things. We have better treatments. But I think it's coming into focus very much for me, all the ways in which society is going to be experiencing the impacts of this pandemic for a very long time. Not just the impacts of the people that we lost, but the impacts of some of the social breakdown. So in that sense, I almost am more worried, even if I'm thinking less about the virus, if that makes sense.
Yeah, I mean, what do you mean specifically by the social impacts? You mean like school closures and sort of that type of stuff?
So yes, sort of. So I mean, the impacts of school closures on kids, but I also mean the mental health impacts of this kind of state of heightened alert
Hmm.
for so long, and the conflicts that have arisen about how people are dealing with this. And maybe I see more of this, or you and I see more of this because of where we are. And so I sort of wonder if I were in a place that had been less COVID careful, like Oklahoma or North Dakota, like maybe I would not be feeling I would not feel like this. But here it feels very much like, as my kids' school takes off their masks, we sort of reveal the fission, the fissures, whatever the one word I'm looking for. We reveal the fractures between the people who are not ready to do that and the people who are, and those reflect a lot of other fractures in society. And I don't know, feel very anxiety provoking.
Yeah, I mean, I remember talking about this, I mean, probably about a year ago plus, how when the virus came out, it's it's a serious situation, obviously. Like this is like a big deal, this virus. Like it was not to be ignored, right? It was very dangerous to people. A lot of people died. It had a really, really big impact. And so sort of at the beginning phase, the messaging is always focused on we need everyone to know that this is serious, right? And so all of the messaging is focusing on the dangers, the dangers, the dangers. And that's both on a sort of strategic level, right? From a healthcare, from government, people need to know that like you guys stay indoors or you could be, killed or you could, like these are really
Yeah.
important. And then sort of the media picks up on that. Well, this is big stuff. This is juicy. So they, everyone focuses on all the horrible dangers of it. And while there's reason to do that, obviously, because maybe it's going to save lives, maybe it's going to get people who wouldn't otherwise take it seriously. I think of the movie Independence Day when these big aliens are hanging over the city and people are like partying underneath the ships and someone has to tell them like, dude, this is not safe. Like, get out of there.
Yeah.
And so there's importance to that, but there's a massive, massive repercussion to that in that you're going to freak people out forever. And so when people think they're going to drop dead if they get near the virus, yeah, there's a lot of people who are going to never want to take off their mask. And there's just no getting around that. It's very hard to balance making people aware of how serious this is with, okay, maybe there is a time when we could take off our mask and go inside and shake hands and hug again. And since there's, so many people who have different psychologies, you're not going to get it right. And some people are going to be not scared enough and some are going to be too scared.
Yeah, and I think part of what I find a little, frustrating about some of the messaging the sort of some of the evolution of the messaging is there is a sense in public health sometimes that we have this one lever, which is trying to make people take things seriously. And that's a lever that we use with frequency and a lever we're very comfortable with. And when we observe population writ large not doing all the things that we think would be important, there is a tendency to just ratchet up that lever. But what happens then is that the people who are already very anxious are then doing more, whereas the people who are not anxious are not who weren't listening in the first place are not listening any more than they would. And
Right.
that's how you get to a situation where there's a lot of people, and this was true certainly, maybe it's less true now because so many people had Omicron, but the sort of in the kind of period in which we were sort of pre-Omicron, there was a real opportunity for a lot of people to get vaccinated. And getting vaccinated really would have saved a lot of people from dying. And yet the messaging, how in whatever way the messaging came out, one of the results was those people didn't get vaccinated, but some people who were already vaccinated a bunch of times became afraid to, leave their house again, even though, and are still afraid to leave their house or to go to the grocery store or to eat inside a restaurant, even though at this point, those risks are really small.
Yeah, that's really interesting. I agree with that people are already fearful, getting more fearful. And I think
Yeah.
one of the other things is, and this is something that you mentioned again 2 years ago when the pandemic was just starting, was that one of the issues with restrictions is there's almost like a breaking point that you can sort of do a certain amount, but once they get too restrictive, people then blow it off, right? They say, all right, I'm out. I'm not doing any of this stuff. And so if you give people sort of like a small and dosed reasonable restrictions, you may get, some follow, some people are going to follow you. They're going to, comply or whatever it might be. But if you say, all right, you can never leave your house for the whole year, people are just like, all right, screw it. I'm leaving. I'm walking out. And it's hard because you have to know exactly where their right point is. And I do think that we probably as a society went overboard. And that's same thing. Why did so many people not get vaccinated? And I think, there's always conspiracy theorists, but they've always existed. We've always had people who didn't vaccinate, and they were this small segment of society. But I think once the government comes in and says, we're going to mandate it, everyone's getting it, we're going door to door and inoculating people dig their heels in and they're like, nuh-uh, not me, and then it becomes a fight as opposed to just, all right, listen, we think everyone should get vaccinated. It's available everywhere. I think the numbers would have been higher.
I agree with that. I mean, it's hard to know in some sense if I think about sort of the two biggest failures, the two things that we did, that we should have done differently or could have gone better, I guess. One is testing infrastructure, which took a very long time to sort of ramp up to where we needed it to be. But the other is the kind of not the development of the vaccine, which was extraordinary, or the initial rollout, which I thought was very good, but the way that it got politicized. And I'm not sure how much of that was an error of messaging or how much of that was, the fault of particular individuals. But I don't think that pushing people or shaming people was an especially helpful message. I also think, the reality is that there's a lot of variation in risk across individuals, and we probably did too little boosting in nursing homes and too much emphasizing of, additional doses for like lower risk groups. And that feels to me like a continuation of a failure we had all along, which was not taking the age gradient enough into account, not recognizing that the number one comorbidity for serious illness from COVID is being old. Like that's just so vastly the number one above any other thing.
Right.
And that didn't get, that often didn't get as much attention as it should.
Right. And we knew it immediately. Because again, we were talking about this, in the end of March of 2020, like literally like risk factor being older. And in terms of everything, vaccinating, in terms of restrictions, masking, all these things, when you do it, to everybody, again, some people you're not doing enough and other people you're doing too much. And I agree. I think that was a pretty big mistake. And it wasn't that hard. I mean, it's not so hard to differentiate by age, right? Everyone knows their age. It's not that complicated.
No, and some places it was sort of one of the most interesting things that happened in the pandemic was looking at the initial rollout of the vaccine across states. So, if you think about back to, a year ago or a little bit more than a year ago now, when states had to make decisions about who to prioritize for vaccinations, there was a lot of distinction between, were you going to prioritize people who had, a lot of in-person contact or older people, and how were you going to titrate that? And I remember talking to, one of the most impressive people I work with in the last year, who was the kind of head of everything COVID related for the state of West Virginia, who basically, I think, knowing that he was going to get a fair amount of kind of vaccine resistance, and they had a huge amount of hesitancy, he went in initially with just this message of like old people,
Mm-hmm.
and just telling people, if you're 80, like your risk is, 1,200 times as high as someone who's 20, and just emphasizing that over and over again, and kind of getting things back to their nursing homes. And actually their initial vaccine rollout to old people was really extraordinary. Then they ran into the kind of left-right bent of their state, and things went worse, but it was initially good.
It was initially good. I'm curious, does the virus concern you moving forward?
In the same existential sense that I think it probably concerns almost everybody, which is like we could get a new variant, the new variant could be different. I will say that the virus has evolved tremendously since the sort of wild type, and it is kind of amazing that the vaccines, particularly the mRNA vaccines, and prior infection has provided such good protection against serious illness, even in the face of a vastly mutated virus. I mean, it just suggests that like T cell immunity is pretty good. That like the sort of COVID funding appears to be disappearing, which seems like bizarre, given that like all seasonal respiratory viruses, we should expect to see a spike in the fall and winter of next year. I mean, even without a new variant, with waning immunity, everything else, I mean, that's going to happen, and probably it will be good to be like prepared.
Yeah.
I think.
I don't know. That's the Girl Scout in you coming out.
Yeah, exactly.
Probably good to be prepared. Someone said that once.
Like,
It's so interesting. I think that Omicron, in a certain sense, was kind of like a big bummer, right? Because this variant came out, and all these people are getting COVID, even those who had it before, even those who were vaccinated, even those who are young and healthy. But on the other hand, I think it really shifted so many people's perspective about the virus to, oh, like this could be something that behaves like a cold, a flu, where a bunch of people get it and then it blows through and most people are perfectly fine afterwards. And I think that it actually kind of, people like loosened up a bit after Omicron went through, and it wasn't the same thing as like the Delta wave last summer.
Yes, because I think at that point also a lot of people who had been very, very cautious leading up to that point, who had effectively done, everything, like had been really cautious about avoiding the virus, had been, boosted and fully vaccinated and everything, then got it.
Yeah.
And, and I think it partly sort of reveals some of just the inevitability of respiratory viruses. And I think partly it revealed to people that, okay, like I'm lucky. There was a frame there, which was like, I'm really lucky that I was vaccinated. And also, this happened and like, it wasn't great. I had COVID. It was like not a great week, but it was also, it was okay. It behaved sort of like a flu, maybe a mild flu. And I think that changed a lot of people's mindset around both the inevitability and just the reality of what it would be like once you were vaccinated.
Yeah. I mean, listen, we're in the hospital, 100% of people are vaccinated and wear masks, and it blew through the hospital. I mean, so many people got Omicron. These are, again, everyone's, for the 6 months prior, no one got anything. And it just shows you that there's only so much you can do for these things. And it also, I was on a flight. I flew to Israel last week, and the whole process, I'm like, what are we doing here? Like, who is in charge of all this? This is like the most ludicrous thing ever. Everyone, before they got on the plane, has to get a PCR test in the US. All right, fine. You don't want someone getting on the plane as active COVID, whatever. I mean, okay. Everybody on the plane has to wear a mask the entire time, except when you're eating and drinking, right? Because at that time, COVID can't be spread, right?
400 people on the plane. It knows if you're eating.
Yeah, when they serve the drinks.
Just like it knows it knows, the COVID knows that that's really me carrier.
Right? Yeah, it's a break. It's like when you're playing tag. It's like a safety, and it's like, no, I'm on safety. I can't be tagged. I can't be out. Yeah, same thing like the airport. Everyone has to wear a mask in the airport, except when you're all the people sitting down and eating, right? So 20% of the people in the airport don't have masks on. You can't get COVID that way. And then we land in Israel, and you have to get a PCR when you land so that you're not in lockdown. And then to come back to the US, you have to get an antigen test. And then the same thing with the masking and this on the plane, except you're eating, drinking. And I'm just like, this is the biggest waste of time for everybody. Like, what? Like, why isn't it just optional? Like, if you want to wear a mask and protect yourself, wear a mask. God bless you. Put on an N95, put a shield over your head, do whatever you want. But if someone's like vaccinated, it's like, why am I wearing a mask, 85% of the flight? It doesn't make any sense. Yet we're all doing this.
Yeah, I mean, I think that the counter to push back on that, I think that the counter that people would say is, look, the world contains vulnerable people, whether it is, immune compromised individuals or, kids who are not vaccinated, who I think we both agree are not in the vulnerable space. But, this is kind of the argument that then, this is all sort of that making it what you're advocating in some ways is really a kind of like totally individualistic approach to say, look, now we have good vaccines, we have, excellent, everybody has access to like a well-fitting N95 mask and full vaccines, and you can choose to protect yourself to whatever degree you want. And, that is an individual choice, the way there's a million individual health choices, right? Like you choose, what kind of diet you eat, or you choose, what kind of other, healthcare care you get. But then there's this piece of it, which is, well, what about the immune compromised? What about What about people who need your protection? For me, some ways I find that argument compelling, but I also think it puts an awful lot of onus on individuals that should be on some, some sort of broader governmental body. That it's not really the job of individuals to be fully responsible for protecting, vulnerable people. I also think that, the marginal impact of kind of you wearing a mask on the airplane, except when you're eating and drinking, on, deaths in a nursing home is pretty minimal at this point. But I think that's kind of where we could do better to try to either make clear to people or, think about how we're protecting these other groups. And by the way, that is a problem that was true before, right? So I mean,
Yeah.
I think that's kind of like, if you were like a sort of late stage cancer patient who's on immunosuppressants, you were vulnerable to infection before COVID.
Oh, yeah. I mean,
And
yeah.
and it, like many other things COVID has revealed, like, boy, it would be, great if we had better ways to protect people in those situations, but it's not different than it was before, really.
Yeah. No, I think that's one of the big changes that if you look at, like you said, someone who's vulnerable because of whatever medical conditions, because of medications they take, because of their age, 2 years and a month ago when they got on an airplane, same problem. They could get a cold, they can get a flu, they can go get adenovirus, they can get anything, potentially. And we weren't telling everyone then to wear masks. And so I think now sort of masks became sort of acceptable in a certain sense. And now it's hard to take these things away. But the real question sort of scientifically is, all right, so if I'm someone who's vulnerable and I'm vaccinated and I'm wearing an N95 mask, what is the relative risk to me if the person next to me is or isn't wearing a mask? And it's probably pretty small, right? Again, if they're wearing a mask 85% of the time, except when they're eating and drinking or something like that. And so it's what is the benefit to that person versus, the inconvenience to 400 people, on the plane. And, there's no right answer to how you balance those things. I'm not claiming there is. I'm just saying that's a complicated calculus that's been made forever. And this is just different, how we're falling on a different side of the line now than we ever did before. And I think that's jarring to people.
Yeah, I agree. And I think, maybe part of the answer is, well, we were kind of in the wrong place on the line before, and that we should have been more, conscious about this. And I think it will be true almost indefinitely that people are going to be more conscious about the choices they make that would spread illness to other people in a way that is probably really good. So, the kind of like send your kid to school when they're a little bit sick or go to the office when you're a little bit sick. My guess is that will be dialed way down now. And that just the sort of social acceptability of saying, look, I have a little bit of a cold. I'm at, like, let's Zoom the meetings today. That's going to feel, I think, 2.5 years ago, people would have been like, sorry, you have a little cold and you want to, like, move our meetings to the phone. What are you talking about? Whereas now people will be like, oh, thanks so much. Like, that's great.
Yeah. Well, some would say that's great, and some would say, all right, now this person just doesn't want to come into work. So I think you're going to get both.
No.
Yeah.
Of course, there's a mix there, but I think that there is a sort of, we will see more of that, whether it's because people are shirking or not. And I think we'll see more masking we'll see more masking at times with respect to the flu and all kinds of other stuff. So
yeah, and I think also, people have argued a lot about the effectiveness of masking, and there's arguments to be had there in both directions. But I think also one of the interesting questions is there's the difference between the effectiveness of a mask versus the effectiveness of a policy that requires people to mask, because those are very different. And
absolutely.
Yeah, because you can say there's something like a vaccine, for example. A vaccine could be, and it is, remarkably effective, but how effective is it, to have a policy about a vaccine? Well, that depends how well it's adhered to and all these other variables that come into it. And I think that's a lot of these arguments also center around that.
Yeah, I agree. I think that basically, like, two things could simultaneously be true, and probably are. One being that if you wear a well-fitting N95 mask, you are much, much less likely to get COVID or anything else, because, there's mask filtration, and we can just you can see that in the lab. You can see that in, the way, like, you can be in a patient room with somebody and, they can be sick and you don't get it because, you're wearing this, this high quality mask. So that could be true. And it could also be true that as implemented, mask mandates make very little difference in terms of spread of COVID, which, I think probably is true, whether it's no difference or a small amount of difference. It's certainly not anywhere close to as large as the difference between you wearing a high quality mask versus not in an environment with somebody who's sick. So somehow, like, we're having trouble separating those two things in the data.
Yeah, you could also look at the data at different points in time. So, if you have, for example, like two states, one of them has a mask mandate and one of them doesn't, let's assume they were similar at baseline, which is also not true, but let's assume they are. You can look at the data in the first month and maybe show that the state with the mask mandate had fewer infections. But then if you waited 6 months, it may have caught up to everybody, that eventually blows through. And so there's so many ways to manipulate this, which is why, people have these sort of preconceived beliefs about mandates, about masks, about whatever. They can cherry pick data that's going to support what they believe based on where they take it from or at what point in time they take it from or how they interpret it, which has always been true in science. But we've never really had these debates in public about these scientific things and putting them on CNN. And so I think it's just gotten real ugly with all these, with the data.
That has been very interesting for me. And I agree it has gotten ugly, that all of a sudden everyone is much more in principle, like people are much more interested in data and much more willing to sort of think about data and to engage with data, and they understand more what charts are and the idea that you would do some kind of analysis, and that's that's been a huge move in the last 2 years that I have seen, as a person who kind of writes about this. But at the same time, we're in such a sort of evolving and in some cases quite data poor environment that it is very easy for people to cherry pick the particular piece of evidence that they want that supports their thing. And, as you say, with something like masks or really almost any of the kind of non-pharmaceutical interventions we thought about during COVID, there are ways to cut the data that show one thing and ways to cut the data that show that just gets weaponized in all of the different directions. And because our data literacy is actually at its fundamental core quite bad, it is hard for people to parse which of these two charts should I believe? There's
Right.
two similar looking people with two different charts on two different television channels, and like, how do I know that like the blonde guy with this chart on Fox News is like more or less reliable than the other guy with the chart on the MSNBC? Like, how do I differentiate those things? That's really hard.
Yeah, I mean, this is partly what you do, and it's a good segue because I wanted to do the sort of we're gonna let Emily go back in time and make all the decisions for everybody.
Amazing. Okay, I'm ready.
On the one hand, you could look at it, where do we go right? Where do we go wrong? But I'm not doing this in like to be judgmental about anything because, okay, whatever. I'm going to say based on your understanding of the data and what you've seen and what, you've read, if you could go back in time, I'm asking if you would do things the same or different. So the first I'm going to ask about, because it's sort of the first thing that happened was the lockdowns. Right. Sort of all those things.
Just so I understand, I get to choose based on what I know now.
Yes, you get. Oh, yeah. Okay. No, based on what you know now,
okay.
Based on everything you know today, what if you could, get in a time machine and go back 2 years?
Right.
So what would you have recommended first in the initial phase when the virus, first hit the scene, and then sort of over the next, year or two with lockdowns, both, home and then also with schools?
So I think when we sort of think about that initial period, actually there was something we did really, really right, was with this idea of like flattening the curve, which put a lot of emphasis on the idea that we need to build hospital capacity. And so I think that wasn't wrong. I think part of what happened was we sort of built the hospital capacity and then never let up on the kind of lockdown. Well, we let up eventually, but we didn't sort of let up linked to hospital capacity. So I think that, building out the hospital capacity and having a period of pretty extensive lockdowns while sort of hospital capacity was built out was a good idea. I think it's pretty clear we did not do anything close to the amount of lockdown that we needed at nursing homes. Mm-hmm. So things like nursing homes, assisted living facilities needed much more testing and much more kind of like restricted access. at least for this initial period until we understood a little bit more about the virus.
Mm-hmm.
I think looking back to ex post, it was a mistake to close schools for certainly for as long as we did. I also, think that it would have been quite hard to continue sort of having schools open for at least some of the spring. So, it wouldn't have been a good idea to reopen schools in, May or June of 2020. I think some people would say yes, I'm not sure. Maybe, depending a little bit on how we were doing on other things.
But come the fall of 2020.
Come the fall of 2020, yes. So come the fall of 2020, we should have had all schools open, fully in person, regular school, 5 days a week with masks.
And is that because, looking back in hindsight, I know that was actually your opinion at the time also, but looking back in hindsight, is that because we've realized better that the risk to kids from the virus is very low, or because the harm of closing school was higher than we thought it would be?
So I think it's both of those things plus a third thing. So I think, if we think about what we learned over time, one is that the risk to kids was low. Although I think, to be fair, we pretty much knew that in almost in March of 2020.
Yeah,
so I don't think we learned very much about that over time. Well, I think what we learned is that the spread in schools was extremely limited. So based on these sort of, even, some of the data we collected, but more than that, these careful contact tracing studies in a bunch of places showed that there was just very, very limited spread in schools, particularly during the kind of whole 2020, 2021 school year. There was just not much spread at all.
Do you think because there was masking and all that stuff, or just because it's not spread so well in kids?
Probably both. So I think, most of the sort of really, really limited spread stuff we have did involve kids in masks. And so I think separating out, how was there more in places with more limited masking? We did masking in most schools in the US. So, but I don't think it's just the masking. I think it was more that, this is a controlled environment and, people were being careful, and kids are just not super high risk, and they weren't spreading as much, or whatever was the reason. Schools were just not places of a lot of spread. So I think there was that. And then the other thing we've learned over time is just how damaging school closures were for student learning, for, families' ability to kind of put food on the table, for kids' mental health, all these things, the sort of implications of school closures, which people thought somehow we would be able to mitigate and so on. I just think were not mitigated. They were bad. So,
well, yeah. And then what about masking and social distancing?
Having spent a bunch of time talking to the guys who are obsessed with aerosolizing and ventilation and so on, I think we missed the boat on the kind of ventilation versus social distancing business. So we spent a lot of time on be distant from people, but actually physical distance is not important. And to sort of the social distancing, which really became part of that, we should have been investing more in ventilation of indoor spaces, probably. On the masking, I think we don't totally know. I think the randomized trial data suggests probably some small mask mandates, like in the Bangladesh data, suggest that mask mandates had some positive impact, but not enormous.
If states were calling you in the summer of 2020 and they said, should we go like Florida? Should we go like New York with masking? Right now, knowing what we know, which way would you go?
In the fall of 2020, I would have said, go like New York. I would say now the choice that I would have suggested in the fall of 2020 was go like New York. But I think we failed to write sufficient off ramps for that.
Like if rates drop or if the vaccine comes out, things like that?
If rates drop, the vaccine comes out. Yeah. I think part of what made masking so contentious was the feeling that it would never end. And this sort of feeling as we said, take them off, then we put them back on. And then the feeling of well, no matter what, we're always going to need to do this. And I think that people really push back on that. So, again, it goes back to, I think some of what we must have talked about, 2 years ago, which is to sort of meet people. You can't ask people to do everything all the time.
Yeah. Right.
And you need to pick you're going to need to pick a set of things that are doable. I think that masking probably is one of the more doable of the non-pharmaceutical interventions, and with good quality masks can have some impacts. So that seems like something to do, but we made it something that was you're going to have to do this forever. And then I think people got upset.
Yeah, and I think also when there were these potential for off ramps, and we've spoken about this before, they were sort of illogical that they're doing it based on like positive rates or total cases, when, like we said, really they should have focused on hospitalizations or deaths or, something that matters, right? Whether someone tests positive or not is not as relevant to whether they're sick. And also the data is more poor because it depends who you test, right? If you test everybody, you're gonna have you have more total cases and a lower percentage. And so everyone was doing it differently and none of it made a ton of sense. And it was very frustrating. Like, I'd be like, all right, there's many more cases. Like, well, everyone's going to school and they're all getting tested. Of course, there's more cases. Like this is ridiculous. So, which is what I want to ask you at the next one, because I know that you feel very strongly about this. What should we have done with testing?
So I think with testing, we should have invested way more heavily in antigen testing. So we got totally focused on PCR testing as a sort of gold standard. And I think that's because from a diagnostic standpoint, PCR testing is really, is sort of the gold standard to detect small amounts of the virus and so on. But I think it was also very clear early on that these antigen tests, these lateral flow tests, which are easy to use, which you can use, in your house, are very good at detecting contagious levels of the virus. Those were developed pretty early on. It took, I don't know, a year, more than a year, between the sort of initial development of things that you could have used in your house and your ability to you're even being allowed to use them in your house. It was many months before we even used them in schools. Like, this just became a kind of total failure and a total failure of messaging. If we had done that faster, this would have been a place where we could, help on the nursing home stuff. Like, how do we get antigen tests so everybody who comes into a nursing home is antigen tested, like every day before they come to work? That would have really improved our situation. And similarly, giving people confidence to do things like going back to school. We want to open all our schools in September of 2020. Like, tell everybody, everybody has antigen tests, and figure out how you're going to implement that. It wouldn't be impossible. The idea that it wasn't until February of 2022 that the government started sending these to people in the mail, like that's just like, it's crazy. Particularly because all the all these universities were doing all this testing, and it felt like we just really fell apart there for a few different reasons. But
right,
we definitely fell apart.
The universities where everybody's young and healthy, they're getting tested twice a week. But at
with
places,
PCR tests.
with PCR tests. But at nursing homes, they're not doing that.
Exactly. That's, we really need to protect the the students who are only leaving their apartments to get their twice weekly PCR tests. But yet we're not somehow able to put antigen or pool testing into nursing home settings. I mean, it just was a really bizarre organization of resources.
Yeah, and I also don't think it would have been too difficult for there to be some effort to get random sampling, random testing to say, what is the COVID rate in the community? Because it was all over the place. Nobody knows what it is because, people are home, they're not getting tested, or everyone's getting tested. And just, it's not that hard. They do this with polling, right? They do it all the time to sample of, 400 people and what's going on in the entire city. It's really not complicated from a logistical standpoint. And I don't know why they didn't do it. It doesn't make any sense to me.
I'm not sure what happened. I think that they, there was some sort of political stuff around testing inside the CDC. I think there were some feelings that, people had about accuracy versus, different kinds of errors. I think also a lot of these organizations were pretty, not great at pivoting.
Mm-hmm.
And kind of, and I think that was an issue. And then, of course, remember, in the sort of summer, fall of 2020, even the early winter, the administration was not, super focused on identifying cases of the coronavirus.
Yeah.
And it wasn't like their jam.
Right.
And so I think, while the Biden administration coming in didn't sort of fix everything the way that some of us maybe thought that they would using a magic wand, it definitely, I think that, things would have looked a little different had there been a different set of people sort of with a different set of incentives in the 2020 period.
Right. Or maybe if we're not an election year.
Maybe if we're not an election year. Exactly.
Yeah. It's really, it's so interesting, all these things play into this because it
Yeah.
changes everything. It changes people's perceptions, which changes, their responses and the reality. It's really interesting stuff. What do you think is going to happen moving forward? Now we're doing prediction, Emily. Now we're going forward. So we can drop this podcast in 2 years. What do you think is going to happen in the next couple of years with all of this? Is this just going to sort of fade away into the sunset and it'll be like, a flu where we get a booster or a new vaccine every year and we just sort of like move about our business? Or is this going to like annoy us and irritate us and we're going to argue about this for the next, 2, 4, 10 years?
Yeah. So I think the question of, I think that for me, that lies in whether you're talking about the next 2 years or the next 10 years. So I think what will happen is, and I think this part I'm basing on, what people, on sort of smarter people than I who do kind of viral evolution. I think the kind of expected path is something like, continued sort of winter surges, like with any respiratory virus, like with the flu, and probably, a sort of moving towards a kind of booster in the fall system, and whether that booster is specific to the variant that's, that's in circulation or not, we'll have to see. I mean, actually, in the summer of 2020, I did an interview with, in my newsletter of all places, with Boncel, the CEO of Moderna.
Mm-hmm.
And he basically was like, okay, like we're going to have we're going to have a vaccine, an mRNA that does like flu, RSV, and the dominant COVID variant, and you're going to get it every fall.
Mm-hmm.
And that's going to be great. And so like, maybe we're going there.
Right.
Then you're not going to have a job,
Yeah.
You'll still have a job. Some people will be out of a job.
Yeah.
I think there's something like that, but we will sort of see these surges. I think that will be true almost forever. We're not moving to having no COVID. Over the next couple of years, I think this will continue to be a significant source of sort of discussion and angst as these waves come in. And also as we work through a lot of the things that are going to come out of, the social impacts and also the health impacts over the last year. I think there's probably more discussion of long COVID than there needs to be, but there's no question that a reasonable number of people have been experiencing these sort of longer term disability effects of infection, much more so people who got it unvaccinated. And that's something that the healthcare system will be dealing with. So there's a bunch of these like knock-on effects that I think will mean that this occupies more mental space over the next 2 years than it will, 7 years from now.
All right. And what are the airlines going to tell us we don't have to wear masks? Going back to my
I think that will
flight.
I think that will be next week.
Oh, really?
I think that will be very soon.
Yeah, I just think that, and I guess
it's
a federal mandate, isn't it?
Yeah, there's no it's a federal mandate. I think that the federal government is not so going back to the issue of politics.
Yeah,
I think that the Democrats are quite worried about midterms, and what, for better or for worse, I think perceive that some of these COVID restrictions, particularly the most visible ones, are not likely to serve them well in the midterm elections. And they are therefore, I think, going to be eager to remove some of them sooner rather than later.
Fascinating. Wow.
That's my like sort of social science, political economy hat.
Wow. Thank you so much for agreeing to come on the podcast again. We love having you. It's always great to talk to you. My listeners love hearing from you, and most of them are, followers of you anyways, but it's really interesting. And I just think that this has been so cool. And and I think it's going to be awesome to play this back to back with us 2 years ago, because honestly, they sound almost exactly the same. It's really remarkable.
It's like, I don't know. Do we think that's good? I don't know. I don't know. It's like maybe that's good. Maybe that's not good.
It's good for you. It's
It's good for me, perhaps.
Awesome.
Yes.
Well, thank you so much.
Thank you so much. It was always really great to talk.
Thank you for listening to the Healthful Woman Podcast. To learn more about our podcast, please visit our website at www.healthfulwoman.com. That's HEALTHFULWOMAN.com. If you have any questions about this podcast or any other topic you would like us to address, please feel free to email us at hw@healthfulwoman.com. Have a great day. The information discussed in Healthful Woman is intended for educational uses only and does not replace medical care from your physician. Healthful Woman is meant to expand your knowledge of women's health and does not replace ongoing care from your regular physician or gynecologist. We encourage you to speak with your doctor about specific diagnoses and treatment options for an effective treatment plan. Paid sponsors of the podcast are not involved in the creation of the podcast or any of the content. Support for our sponsors should not be interpreted as medical advice from the podcast, the host, or the guests.